Welcome, everyone. Thank you for joining me today. I'm Dr. Zhu, Psychiatric Clinical Director at Seattle Psychiatric Alliance. With 20 years in pharmaceutical and biochemistry research, I approach mental health as a scientist first, holistic, objective, and evidence-driven before stepping into my role as a prescriber. Today, we'll explore some core questions. What is mental health? What causes mental health challenges? And how can our pyramid of mental health model at Seattle Psychiatric Alliance offer real hope? We'll ground this in physiology, neurobiology, trauma studies, and cultural insights with practical steps to build your well-being. Let's start with the basics. What is mental health? What is mental health? What comes mind often include feeling sad all the time, social isolation, substance addiction, relation difficulties, dissociation, psychosis, lack of motivation. But what is causing all of these? Here, I summarize 6 key conditions that often cause mental health problems: unmet physiological comfort, stress, insomnia, boredom and lack of interest, emotional insecurity, loneliness, social isolation, lack of self-esteem and purpose in life, biological susceptibility, and trauma. Mental health often feels like a personal emotion, subjective and vague. But let's trace it back. It's the result of meeting universal human needs like food, safety, housing, healthcare, social connections, and social status. These are objective, measurable foundations for pleasure, security, and life satisfaction. Imagine it as a pyramid, our pyramid of mental health model. At the base, life and safety, with food, shelter, warmth, healthcare, and security. Next, physical health promotion through exercise, nutrition, and innovations. Mood relies on relationships, thought processes, and emotional safety. Social status comes from job security, assets, and purpose-giving interests. Finally, behaviors shape how we engage, influenced by environment, competency, and boundaries. This bottom-up structure shows strong foundations build resilience, enabling subjective well-being at the top. Sound mental health emerges only from robust physical health and social well-being. Physical health draws from safety, health promotion, and mood. Physical stimulation is necessary for better attention and motivation. Stable mood, through relations and safety, fuels exercise and vitality. Social well-being stems from social status and behaviors. Purposeful jobs boost social status. Healthy boundaries foster social ties, which help with stress relief. On the contrary, poor mood erodes both social connections and social function. Mental health issues often invade cognition and senses at the base of the pyramid, disrupting everything nearby and above. They cause job loss, housing instability, and physical decline. Mental health thrives when needs are met. Social participation reduces stress, physical activity nourishes growth, and support networks buffer chaos. Mental health is not just no illness, it's a dynamic balance to navigate emotions, connections, and pursuit of life purpose in the chaos of social environment, as well as physiological and psychological challenges. What happens in the brain when mental health problems occur? First, there is a physiological response. But the brain is not the only organ involved. Current understanding sees mental disorders as resulting from aberrations in brain physiology, which are targets of psychotropic medications, but the true mechanisms are highly complex and intertwined with environmental and experiential factors. Prefrontal cortex activity drops in many disorders, impairing rational thinking and impulse control. In PTSD, the amygdala overactivates in fear response, while the memory processing center hippocampus shrinks in volume. Roots often lie in the nervous system and beyond: brain, spinal cord, gut, nerves. The HPA axis links gut issues to depression, anxiety through stress hormones. Inflammation activates this axis, worsening psychiatric conditions. The gut microbiome influences the brain-gut axis by producing neurotransmitters. Disruptions could link to autism and depression. That's why, at Seattle Psychiatric Alliance, we emphasize diet and nutrition in mental health interventions. The Western psychiatric model uses DSM-5 diagnoses for symptomatic relief, naming issues, and prescribing SSRI for serotonin, stimulants for dopamine and focus, or antipsychotics for mania. CBT rewires thoughts. Talk therapy unpacks emotions. Medications are categorized by mechanisms of action. However, the truth is that no psychiatrist is able to say a psychotropic medication is effective simply due to one particular mechanism. One medication can act on the human body with numerous mechanisms, both directly and indirectly, to achieve the desired or undesired effects. Psychiatric medications are primarily studied for symptom reduction over short durations, but are often taken for years by many people. Side effects can mimic or worsen symptoms, leading to misdiagnosis or a spiral of worsening symptoms. How effective is current treatment model based on DSM-5 diagnoses? Here, I have some reports from many people. I end up having more and more diagnoses without improvement. I feel bullying from more and more labels. I don't see the end of treatment. I have no quality of life. Let's recall our pyramid of mental health model. Meds and therapy mainly modulate senses and cognition within limited scope. Meds, like stimulants, boost dopamine for pleasure, motivation, but nutrition, exercise, hobbies, and challenges do this too, without side effects. Antidepressants aid mood and sleep, yet long-term use causes emotional blunting, harming social function and social integration. Psychotherapy, CBT, DBT, helps, but office talks rarely ensure behavioral change. Meds, therapy are essential in crises, but prescribers must explain what the medications are actually doing for their clients. No med eradicates the causes of mental problems. Prescribers must be able to tell their patients or clients that the medications not only affect the memory center hippocampus, but also the prefrontal cortex and many more. Medications contribute to changes in sensation, intuition, and cognition, causing emotional numbness, lack of energy, and further social isolation. I find many psychiatric prescribers claiming use of antipsychotics for auditory or visual hallucinations. In fact, this is not what antipsychotics are actually targeting. Everyone has experienced psychotic episodes. In our dreams, we all hear voices and see things that are not physically present. And yet, we don't take any medications for having a bad dream. Since medications fail to address the root causes, but often create unbearable side effects, or trap them in a cycle of tolerance and withdrawal. Many people may rely on illicit substances that provide a powerful, immediate, although temporary solution to their sufferings. Then, where can we look for a true solution? Build the pyramid foundations: social connections, employment, nutrition, safe environment, physical exercises, life purpose, and more. A core contributor to mental health issues is unhealed trauma. How does history of trauma affect the foundation of the pyramid? Trauma is defined as the lasting emotional echo of distressing events, big or small. Every adult has faced it, big T, like abuse or disasters, or small t, like chronic discrimination or feeling unseen. Trauma doesn't start in the mind. It embeds in the nervous system, the brain, gut, spinal cord, and nerves that are designed to flag threats in our life. Trauma memories invade, dysregulating fight-flight-freeze response, overriding prefrontal cortex, shrinking hippocampus, suppressing immunity, fragmenting identity and memory, and, eventually, weaken and destroy the foundation of the pyramid of your mental health. Trauma survivors lose jobs, family ties, hobbies, even basic self-care. Why? Desperation for relief. Over the past decade, hundreds of people have shared the same story. They turn to substances, alcohol, marijuana, fentanyl, for a quick fix. They know the risks, overdose, addiction cycles, but crave temporary peace, pleasure, or control. One said it starkly: "I'm not afraid of death. I'm afraid of living in pain." At Seattle Psychiatric Alliance, we understand drugs can make a person feel, quote, unquote, normal, relieve pain, or experience a sense of connection that was previously absent. Substance use and abuse is a desperate attempt to solve your problem of emotional pain and social loneliness without awareness of sabotaging the foundation of your own pyramid of mental health. We address your pain by targeting the root causes: the loneliness, life discords, sensation overload, or misinterpretation. By strengthening other components of the pyramid foundation, your mental health well-being will not collapse, simply because of some substance use in the past. Back to the question, people are more interested in learning. Can Seattle Psychiatric Alliance alleviate the pain? The answer is yes, we alleviate pain. How? The answer is simple. Escape. Escape from the emotional pain by thinking and living differently. We provide resources for new environments, relations, networks, interests, and joys. We help rebuild the pyramid. Some people feel hopeless because of their chronic pain. Chronic pain itself is often characterized by the neuroplastic changes in the central nervous system, leading to central sensitization where ascending pain signals are amplified. Healing and transformation require confronting the underlying issues and engaging in deliberate, consistent action to rewire the brain. Managing pain through neuroplasticity involves utilizing the brain's capacity to reorganize itself to disrupt the maladaptive pain processing pathways. The brain is capable of change throughout life experiences due to neuroplasticity. The foundation of recovery is to repair the wiring and train the nervous system to be steadier, capable, and tolerant of uncomfortable emotions. This includes shifting the body from the sympathetic or alarm, fight, flight nervous system to the parasympathetic or calm nervous system. The maladaptive pathways created by trauma and stress can be intentionally rewired. Actions like physical exercise can boost neurotransmitters and promote neuroplasticity by increasing BDNF or brain-derived neurotrophic factor, which helps regenerate nerves and rewire connections. Nutrition, from the lens of functional psychiatry, helps soothe PTSD by addressing underlying biological and nutritional deficits, supporting brain function, and managing common comorbid symptoms such as insomnia and anxiety. Another thing that hits me hard in my psychiatric mental health practice is this: I can't change. This is the way I am. Personality and culture trap me. Self-identity is integrated in the pyramid of mental health. The recognition of self-vulnerability proves that your cognition and sensations are intact. You are not alone. You are the victim of childhood neglect and cultural narcissism in our consumerist society. Seattle Psychiatric Alliance accepts you and partners with you in your real life, acknowledges the strengths in your personality, but will introduce you to a new culture that can change hollow self-esteem to life validation and celebration with others. Self-identity and culture are not unchangeable, but need to be explored in a wider social context. Your employment, social roles, social connection, and environment have a huge impact on your identity and recognition of your cultural belonging. A positive change in thinking process in the pyramid is possible. Let's talk about neuroplasticity again. The brain is capable of change throughout life experiences due to neuroplasticity. The persistence of functional reorganization of the brain after the termination of neurofeedback training is an indicator of neuroplasticity. Neurofeedback training is performed to retrain specific areas of the brain based on the location of deficits and frequency bands which need to be trained. This is usually achieved in an isolated room through either visual or auditory feedback, which can be in the form of brain games, movies, or other brain gym activities. Neurofeedback is essentially a form of feedback-mediated cognitive behavioral therapy. Imagine this. What about trying to do neurofeedback training in social activities? In Seattle Psychiatric Alliance, you will have the opportunity to explore many programs to retrain and rewire the impaired brain circuits through real-world engagement. You will explore and find your genuine identity on your own. As you can see, we focus on the foundation of your pyramid of mental health, your senses of safety, your body physiology, your intuition to learn. Our approach at Seattle Psychiatric Alliance is to build and strengthen the foundation of your pyramid of mental health. We reject determinism. We are your alliance for life exploration and rediscovery. Our 166-item evaluation reveals your family and cultural wounds. Transactional analysis is to identify root causes and patterns. Hybrid interventions. Morita therapy with CBT, DBT, is applied for behavior and habit change. More importantly, we provide life partnership. We walk with you in where you prefer: city life, flower farming, skill building, and schools. We help building your self-esteem, relations, and safety network. We have also established community groups to counter isolation. You're positioned for reintegration and societal thriving. Back to the pyramid. Success isn't zero symptoms, it's thriving. Traditional models chase the number drops, like depression level from 15 to 10, but we add holism, track social activities, and daily function. We help where traditional models stall, healing trauma through a new life, responsibility pacts for personality, societal positioning against toxic culture, hybrid therapies counter passivity, Facebook Action Group for belonging. From stuck to contributing, that's Seattle Psychiatric Alliance. All you are going to do with Seattle Psychiatric Alliance is to build your own pyramid of mental health. Let's discuss further how we can build and strengthen the pyramid of your mental health to support your well-being. Join our action group for mental health and contact us at consult@Seattle Psychiatric Alliance.org. We are here to listen. Thank you and take care.